Next up, certainly not least of us, but the last one of the panelists to go before we get into some general questions is friend and colleague Rick Klau from over in California, my home state. Rick is the state of California's Chief Technology Innovation Officer. His team launched the digital COVID-19 vaccine record portal in June of this year, just last month and a half ago, built on open source smart health card framework guidelines to provide digital vaccine records statewide. More than 1 million digital records were delivered in less than 2 weeks. Rick, looking forward to getting an update on where you're at now. But previously, before joining the state of California, Rick spent more than 13 years at Google. He began on the business development team, moved to the product management, where he led multiple product initiatives on some of Google's largest consumer products. Rick, real pleasure to have you here and the voice of the state of California in this. Same question to you. If you could just spend a few minutes briefly describing the effort you've been leading for a while now, the goals of it, challenges and obstacles that you face, and how you overcame them.
Sure, happy to be here, and thanks for having me. It's been quite a journey. Even in the context of this workshop where we heard first off on the immunization registry discussion, what we have in place here in California really was the foundation on which everything that followed was built. That said, that was both the opportunity and the challenge. As with any system of record that is itself a recipient of essentially donated, contributed data, it was only as good as what was given to us. And until we launched the digital vaccine record, I'll talk a little bit more about that in a moment, there really was no way for the public or even many of the contributors of that information to really know how complete or accurate that information was. It just was a bit of a black box, candidly. And once we launched the digital vaccine record portal in June, it was the first time that California residents had been given access to their own data in a digital format. This notion, you've heard several panelists this morning talk about empowering individual control and access. And that really was the guiding principle behind what we wanted to do when we started talking about how we might launch vaccine verification of some kind in the state of California. That we wanted to give residents access to their own information and then equip them to decide what, if anything, they wanted to do with it. There was never really any discussion of anything else other than we want residents to have their own info and then be able to present it if they choose to. When we started down this path, we knew we had the immunization registry itself. We knew that we weren't going to have some of the capabilities or advantages. You heard Sandy talk about what they launched in New York. We did not have, and we're pretty confident we would not have, an app to which we could deliver information for everyone in the state of California, which limited some of our choices early on. What we did, however, want to do was figure out a way to leverage what was in the immunization registry itself and figure out a way to open up access to that data while preserving resident privacy and keeping that information secure. So I won't go into all the technical details of how we did what we did, but very briefly, when we launched in June, we had a front end that gave residents the ability to give us information that they believed would match what was already in our system, namely their name, their date of birth, and then the contact information that was going to be associated with their vaccination record, either a cell phone or an email address. What became pretty obvious post-launch was that not every provider had shared that information when they registered the doses. Providers were understandably most focused on getting shots in arms. And sometimes the data that flowed wasn't always as complete as we would have liked it to be. However, an unintended benefit of launching this to the public was that now suddenly residents, patients, and their providers had a strong incentive to quickly clean up and remediate that data. So what we've seen in just the 6 weeks post-launch is a tremendous upsurge in the amount of data either resubmitted or corrected. systemically. So instead of trying to solve missing data or incorrect data one resident at a time by getting all of the records from a pharmacy or all of the records from a health system, we can remediate hundreds of thousands or even millions of Californians all at once. So to catch up, you mentioned that in the first 2 weeks, not even actually just under 2 weeks, we hit 1 million digital vaccine records delivered. Today, sometime later today, I believe we will pass the 2 million mark, might be sometime early tomorrow morning. And it's been accelerating. I think the most interesting note here, I realize this discussion is really focused on international travel. There's an interesting flywheel that happens at both the local level, and then if you scale all the way up to international travel, that much of this question of credentialing and equipping residents with the information that is theirs to own is that once they have access to their vaccination record, and once they decide where and when they want to share it, becomes part of hopefully the normal course of business over their day-to-day interactions. What we've seen entirely organically in the state of California over the last 10 days is a groundswell of effort at bars, restaurants, comedy clubs, venues where there are large gatherings, where they have decided. I had one conversation with a bar owner last week who told me a bar down the street had 5 fully vaccinated bartenders all get infected with Delta in the same night. That it was just a question really of existential survival. The only way they were going to be able to keep their staff safe and healthy and keep their doors open was if they had some way of knowing the people coming through their doors were in fact vaccinated. This is at a microcosm, the same question we're trying to talk about here in the context of people walking through the doors of a country instead of the doors of a bar, but the premise is still the same. So in the absence of a state or national mandate is asserting that there needed to be proof of vaccination, the bar owners, the clubs, the restaurants, chambers of commerce started doing it themselves. We equipped them with this ability to issue credentials to residents, and then the businesses decided how, when, and where to assert that proof would be needed. In just those 10 days, we've now seen well over 1,000 businesses in the state of California start posting posters on their windows or checking vaccination status at the door as a condition of entry to indoors in those businesses. And what we believe is likely to happen, thanks in large part to what Sandy announced a few moments ago, with the state of New York now giving New York residents the same ability to assert their vaccination status using the same framework that we've adopted in California. The state of Louisiana has already adopted, that CVS, Walgreens, and others, Epic and Cerner customers among them, that we're now starting to see this groundswell of a common mechanism for vaccinated Americans to assert their vaccination records, which is both empowering to them, but tremendously efficient and effective for anyone wanting to know what the vaccination status is of those American residents. So it's been an exciting couple of weeks on the heels of a launch that happened not even 2 months ago, and we couldn't be more excited to see where this goes.